Hello and welcome. We're going to test out a couple of new names. Well, actually, just one new name. We're trying to find the right name for this video. So we're going to start by saying the doc and the captain. So let us know what you think about that. But to get into the meat and potatoes of today's discussion, we opened up some questions on the CTC Facebook site, and you guys threw some thoughts on pain-related questions.
Absolutely.
So we wanted to take an opportunity to take those questions and get you some answers. So, Drew?
Yeah, well, eventually I think we're going to do like a Facebook Live video for this for fun, maybe a YouTube Live, just to maybe have you guys have different, obviously not these questions, but maybe some other ones in the future.
No, the exact same questions. We're going to revisit them in a live version.
Anyway, you know, at the bottom of this video, ask more. You know, we can type some more responses too. You know, give us more ideas. We're having way too much fun with this. So.
And again, when we deal with injuries, of course, we are held to certain standards. If you do not feel comfortable, or if we do not feel comfortable responding in that, we'll reach out to you personally. We want to definitely be sensitive to everyone out there. So if you do have some questions, either personally IM us, or just reach out to a phone call.
All right. Well, the first question we have here, I'm going to read it here. When pain is present on certain activities and not on others, should you have it looked at? So, you know, I kind of dig into whoever this, I don't remember who it was.
This was Izzy's question.
Izzy, okay.
She said something about she had it when she did squats and lunges, but not when she rode the bike, things like that.
So if it's something similar to that, where it's just a specific activity that's bothering you, I would recommend kind of modifying that activity. You know, if it's squats and lunges, then maybe, you know, step out a little bit different. You know, have a professional look at you, make sure your form is correct. That's kind of really the trick there. If this is another case, like you have somebody that is, you know, it hurts when they run and not when they bike, that could be something with running form and different things like that. You know, in this case, I would say get it looked at. Definitely get it looked at. And we're going to talk here in a second. What's the, you know, the real difference between I'm in a little bit of pain, or this needs to be looked at now. So do you want to elaborate on that?
With that, the first thing that hopped in my brain was possibly some issues with the form.
Yeah.
Especially since it didn't hurt on leg extensions, leg curls, things like this. I would question, one, the form, and also then the depth of the squat or the lunge. So the flexion that you were putting on the knee would be a question that I would have with that particular. Yeah. But again, that's something that we can diagnose and look at from that. But that's kind of just reading the question on the surface. That was one of the first things that popped in my head, Drew.
Yeah, absolutely. So moving along that same path, you know, what's the real difference between, like, I'm sore after after a workout, you know, and we all go through this, and what's injury pain? I use my kind of threshold is a 5 out of 10 pain. So 0, no pain, 10 is emergency room time. If we start going above a 5, to me that's sharp. And if we have sharp pain, you know, if it's a 1 quick, bam, sharp pain and gone, I don't get too worried about it. But if we have consistent 5+ out of 10 pain, that means it needs to be looked at, or we might be actually injured. So, yeah.
That's the exact. All my schooling was the exact same, that 0 to 10 scale, and just kind of rating it from there. And anytime that you started creeping on the 5 or above, that's when you're starting to get into a serious situation.
It's your body telling you something's not right. So, all right. Next question here. What are things to do to alleviate post-hard workout soreness?
I have to also say that I'm really impressed that you're able to read my handwriting that well.
That's half the battle. All right, so things that I like to recommend after like a really hard workout, you know, get into your flexibility. You know, sometimes if I'm really sore after a run, you know, Sunday's my long run day. Sunday night, if I'm sitting watching TV, which we're all guilty of doing, I will literally sit there for an hour and a half and stretch. You know, stretch my hamstrings, my hips, my shoulders, everything. And that kind of really just kind of gets everything to calm down for me.
In addition to just that, to speak of it, also just elevating your legs.
Absolutely.
So getting everything kind of rushing back into the body to be circulated properly is another one while you're already in that lane or kind of seated position.
Yeah, there's a little bit of evidence for a massage gun. It's basically like a nice massage. Aaron has one, he uses it. I think he enjoys it.
A lot of the times I use that for but there is some things where, especially long run days where that plantar might get, the bottom of your foot might get a little bit tight. I do utilize it on that. So it's been very, very beneficial from that. And then throwing it on the Achilles is pretty good too.
Also, ice bath. There's a little controversy with ice bath. What is it really doing? If it's taking away potential healing mediators, healing blood flow from the area that you have the problem with, maybe that's a bad thing. It's back and forth. Some people swear by it, some people say no. There's not really great solid evidence to say everybody should do it. And there's not great evidence to say, no, don't do it ever. So, that's that one's on you.
Well, and a lot of the things that we've talked about, especially in these videos, everybody's physiology is a little bit differently.
Absolutely.
I actually love ice baths. Now, not everybody signs up for them, but I regularly do them if I do have some type of nagging injury, and it seems to work for me. But again, this is one of those things where I'm well in tune with my body and know how I react in those particular scenarios. So it might be something where you give it a try. If it's something that benefits you, maintain it. If not, move on to the next thing.
Yeah. One thing that actually works pretty well for me too, if I have a really hard bike workout or a run workout, honestly, jumping in the pool and swimming, I know none of us like to do it, right? Where's Justin? Swim's canceled, I know. Anyway, but a nice pool session, even if it's easy. And then I jump in the hot tub afterwards too and just stretch afterwards, kind of stretch my arms, stretch my legs, and it always feels a little bit better.
One of the things with the pool, I would recommend a lot of kicking, getting kind of the lymph system, really flushing the system, getting a lot of blood flow, getting that oxygenated blood throughout the body is a very, very big benefit for the body. And it really, again, by getting in the pool, we're assisting other aspects of our training and benefiting our life as well.
Yeah. And the last thing I'd recommend, there's a lot of people have Normatec boots, or they go use Normatec boots. There's everything that we do is really, as science-based as possible. So they have their own research studies that'll show, decreasing delayed onset muscle soreness pain and X, Y, and Z. If it works for you, do it. That's what I'll tell you.
Absolutely. And
some people swear.
They have a lot of different settings, so it might be one where you're pulsating from bottom to top, so it goes from the foot up the leg. There's others where you have full compression and then it releases that compression. What's supposed to is just kind of create a real pump of blood
flow. Yep.
So there's some things that support it, but again, it's really what benefits you. We're not definitely saying go out and buy a $1,300 piece of recovery equipment, but if you have an option to try it out, it's on the list.
Absolutely. All right, next question. When to ice and when to add heat to pain? The important part is we do not want to add a bunch of heat to an acute injury. So 24 to 48 hours, we should not be putting moist heat on it. If we already have what we call active inflammation is red, swollen, puffy, new inflammation. So that's not something we want to put heat on. That could actually cause maybe a little bit too much. I'm going to tie this into another one of the questions at the bottom, which was talking about the good old Rice method. Mm-hmm. So there's been definitely in recent years, there's some controversy. Are we supposed to ice everything? Are we supposed to take anti-inflammatories every time we have an injury? Are we supposed to do this, supposed to do that? So what we kind of found over lots of years of doing research is inflammation is not bad. There's nothing really wrong with inflammation. Inflammation is your body trying to heal itself.
And real quick, rest, ice, compression, and elevation.
Yeah, Rice. Anyway, so the time to use ice is when you have very active, very red, you sprain your ankle and there's bruising everywhere. It's time to do some ice now to kind of help maybe limit the amount of swelling if it's going to be a lot. After 48 hours, it's really up to you. If you put ice on your knee when it's a little bit sore and you're in that 2 out of 10 pain and it feels better, do it. If you put heat on your back when it's sore, when you're in a 2 out of 10 pain and it feels better, do it. That's kind of what I tell everybody. Truly, the depth that ice or the heat is going, we might get, if we leave heat on for long enough, we might get 7 millimeters. And you guys can go get your ruler out and see how deep 7 millimeters is. So, if there's a problem deep inside your, the knee's not a great example, in your back, 7 millimeters is really not enough to do anything but kind of warm muscles up.
And really, from studies, it shows that it only sticks around for about 15 to 20 minutes. Yeah. It's just, think about it when you take a hot shower, that you get out, that heat kind of stays around for about 15 to 20 minutes. Then
absolutely.
Body comes back to regulating the temperature. It's been shown that ice stays around a little bit longer, but it really, when it gets to that point, especially after that first 48 hours, it's more of what feels best to you. And I know one of the questions and emphasis on that rice question as well from Michelle was about the rest aspect of things, and that more orthopedic information that comes out shows that movement is becoming very, very key in continuing that development, increasing blood flow to that body, and by just shutting it down, sometimes you keep the inflammation in the area for a longer period of time. You lose a little bit of range of motion. So if, again, you go back to that 10-point scale and you're not around that 5 or above, get some movement into that, just because it's going to end up keeping that range of motion. It's going to continue to keep the blood circulating and allowing for the injury to really get over those first stages of inflammation and pain.
Yeah, and by no means are we saying run on a fractured leg. Just just telling you guys that right now. If it's a true injury and you've been diagnosed with something and they recommend rest is the right thing for you. But we're talking about the in-between stuff, right?
Taking the David Goggins approach on that particular is not a smart thing to do.
Bad idea. All right, next question. How long should you let something nag before getting it looked at? I tell people about a week, okay? So if I have let's say my knee hurts a little bit and I did some extra miles in that week, and by 2 days later, 3 days later, I don't feel anything, we don't need to have it looked at. That just means we might have done something either too aggressive, too intense, and that's your body's response telling you it might have been too aggressive, too intense. Now you have something going on and we get to 7 days and it's still kind of nagging you. We get to 10 days and it's still nagging you. Get to see a professional. Whether that is, it's time to see ortho, like the docs, whether, you want to go see a foot doctor, whatever the case, or, find a good therapist. That's kind of, a week is a good time frame for that.
It really starts to affect your overall training too. I would add, if right off the get-go, if it's completely changed your week, then that might be something also to maybe before that week standpoint, just because you should still, in certain cases, if we've overworked, we can still get into the movement, we loosen things up, we get that blood flow, we start to decrease some of that pain. It might come back after the workout. Again, it's showing that we might have done too much, but if that pain gets too intense for that initial warm-up of that next activity,
then it might
you're probably going to change your routine for the week. It might be best to have somebody take a look at it and get it looked at from that standpoint.
Yeah, and obviously if you think it's extremely injured or really injured, and you're in that sharp pain range and you can't walk, okay, it's time. It's time right away. We're all notorious for waiting too long, and
Absolutely.
that's me included. We're all, it'll go away, it'll go away, it'll go away. If you get to the week or you literally can't walk, go get it looked at now. Because the sooner you get it taken care of, the sooner you're getting back to what you want to do. So.
And I've said this in past videos, but I would recommend try to avoid just putting the random picture of my foot hurts here.
With the finger pointing to it.
And just because in those particular scenarios, you're going to get a lot of people, I had this happen 2-3 years ago or things like that, and everybody has their own situation. So I would be a little afraid. Now, if you want a professional like Drew to reach out, that's fine, but I would probably reach out to him particularly rather than allowing a bunch of people that might not even know a bone in the leg to start throwing things out there.
Yeah, Absolutely. All right, next question. Ice bath versus Epsom salt bath versus warm bath. We kind of hit on the ice bath subject already. We can get more in depth with that if you really want. We can talk about temperature, but trying to keep this remotely concise. Epsom salts. So if you look into the research, the only benefit that I could find, and I did actually a little bit of research on this, was the potential for increasing the amount of magnesium in your blood. Mm-hmm. Thought that was kind of I actually didn't know that. So what they said, let's see here on their website, they say will relieve tired, achy muscles and refresh skin appearance. So if that is what you need, then give it a shot, and if it works for you, awesome. There's just really not great, nitty-gritty science involved in this one.
That one also could possibly be from the warm water of the actual bath itself. So that's where we can't necessarily, with all confidence, say that this is the thing to do. I do think that it probably, especially with the magnesium and some of the other things that are involved, it makes your skin glow, and it's marvelous from that standpoint. But as far as the actual science behind it, it's kind of hard for us to really point in one direction or another. Again, it might just go into that list of things that you personally try. If it helps,
do it.
Roll with it.
Absolutely. All right, next question. Nagging side pain, or a side stitch, is what I think that this question was about. When do you stop? When do you slow down? Hydrate, salt. So nagging side pain I see as a side stitch. Mm-hmm. And what a side stitch actually is, who's the researcher? Plunkett, there you go. Visceral ligament pain is actually what they found is the most likely cause of that. That's actually a theory, so maybe it is, maybe it isn't. So their best method to stop a side stitch is bending forward while contracting your abdominal muscles, tightening a belt around your waist. I wouldn't do that one. Or pursed lip breathing, which is kind of breathing out like you're blowing out birthday candles, if that makes sense. So in through your nose, out through your mouth, but blowing out like you're blowing out birthday candles. So that
sniffing the roses, blowing out the candles is what I always recommend.
So if we're talking about other side, if we're actually talking about a muscle cramp, that means your body needs one of a couple things. So either we're dehydrated, we're either we don't have enough electrolytes in our body, or we don't have enough calories in our body, or we've fatigued that muscle so far that it just doesn't have anything left to contract. So the problem is, who knows which one of those things it is in any given situation. So you can always try to hydrate or try to add salt, but the best method would probably be to just slow down a little bit and walk, try to get to recover, and then try to re-pick up what you were doing before.
Yeah, at that point, it's kind of, you're beyond the point of being able to really get your body to the point of being able to turn over and get to perform high performance. So backing it off a little bit, you probably have a good idea if you've not taken in enough calories, not taken in enough hydration. So you might be able to better answer that question in that particular scenario, but these are just some of the things that it could possibly be.
When stuff like that happens to me, I go through like a weird triage method in my head. I'm like, wait, did I have enough calories? No, I think I had enough calories. Okay, did I, I feel really thirsty. Am I sweating still? What's the temperature? I mean, there's so many factors that go into actually like muscle cramping. We might be able to get into that. We'll do that in a later video. Maybe talk about calorie burning and cramping and stuff like that.
Good idea. I think the one thing that we both probably would recommend, that if you're not sweating in that particular scenario, that you need to shut it down, and you probably need to seek somebody on the course, because that's when it really becomes a situation, is when you're having that type of pain, but also there is just, you're kind of flirting mentally in and out of
a normal state.
Yeah. And just not sweating. That's when things are dangerous. So that would be the point where, all caps, shut it down.
All right, next question. Cold weather, and we did this on Sunday. Anyway, cold weather, feels uncomfortable to breathe, feels like insides are on fire. I know that one very well. So The best way to fix that is actually to wear like a mask over your face. They've got facial masks. What that does is basically just warm the air up a little bit before it goes into your lungs. Maybe start with that, take it off when you actually feel like you're warmed up, put it back on, maybe a scarf around your mouth, whatever whatever method you want to try for that. Or guess what? Just go on the treadmill. No one likes it, but you can get almost the same amount of work accomplished, and maybe in a different, environment. If the race that you're training for is a cold weather race, you better just do it outside and try to get used to it. Try to, acclimatize your body to that sort of thing. But, a mask in the meantime might help that a little bit.
And that's the best piece of advice right there. There's a point where we all try to suck things up, and this one is more of, of course, when you walk outside, if it's under 0 degrees and there's a wind chill, the question is why go out in that point? But if it's just from the standpoint of the lungs feel like it's just the contrast between the outdoor temperature and the temperature that's coming into your body and the temperature of your body. So sometimes it, like Drew said, just having something that kind of helps warm that, or staying on the treadmill is not ever a bad idea in that particular case. It's just being smart.
Yep, absolutely. All right, we already hit on the rice subject. Well, we got it. Well, this is a great question. Yeah. When should you push through chronic pain?
That is a good one.
This is really easy. Never. That was the easiest question we've talked about so far. So most chronic pain can be fixed, if that makes sense, especially if we're talking about exercise-induced chronic pain. So there's no reason to kind of push through it. Now, if you have, I don't even want to justify this. If you have a race and it's 3 weeks away and you have to do it for X, Y, and Z reason, and you've got some pain in whatever, and you want to push through to finish it, I still would say no, but there's always a situation where we maybe, you could justify something, but that's an individualized, extreme example basis.
And especially if it's muscular at that point, you're better off getting dry needled or worked on and taking that day off and then coming back with some stretching and getting into a little bit of activity the day after. Like Drew said, there's no point, and there's probably some other things that we can adapt or put our body through and get positive adaptations in that process.
It's more fun to race when it doesn't hurt, just so you guys know.
Absolutely.
Yeah. All right, last question. Pros and cons of NSAIDs. We're not even going to say controversy. So if you have pain and it is more than just a little uncomfortable, then take your over-the-counter medications. Does every injury need an NSAID? That kind of goes along with that rice perspective. So, if I bump my knee and there's a little bit of swelling, do I need to immediately take NSAIDs? No. Okay, we do not need to take them right away to try to get rid of the inflammation. If there's a lot of inflammation or, it's really swollen, okay, now it's time to take an NSAID, potentially. This is always better to have a medical professional look at it and tell you, whether that's, like I said, your primary, ortho, PT, whoever, if it's really necessary. Some people will take NSAIDs pre-competition, and I've been guilty about that in the past. Maybe it won't hurt as much if I take 4 ibuprofen before. There are some risks of cardiac events if you take in enough NSAIDs. Obviously, there's other risks, and you can WebMD it if you want, but we're talking, ulcer in your stomach and, all sorts of other things that go along.
Internal bleeding is another thing.
With just taking, chronic use of taking NSAIDs. So we never want to take things for, that same thing, how long should I let something nag? How long should I take NSAIDs before I'm really worried? You shouldn't be taking them for more than a week unless it's prescribed. If it's prescribed, there's a reason for it, but you shouldn't have to take a medication over the counter for an entire week, and that kind of goes with everything. If you are, then time to go get it looked at.
And another piece that I would add to that is that if you're utilizing it to camouflage that pain, sometimes you might take it as a precursor, but never actually go in to see if you've recovered over that particular injury because you're taking that NSAID. I would much rather prefer to feel a 3 pain rather than numbing up a 5 pain. Like we had talked about, that number is very important. So if we're numbing up a number and it gets worse throughout that activity, we might not have the sense of the body to let us know that we should shut it down.
Yeah.
So there's also some scenarios there where I would recommend just going all natural, just because the standpoint of sometimes you want to feel what the body's telling you, and if you do numb it up to some of that pain, it can be a bad thing. Like Drew said, they're effective when they're kind of used for the anti-inflammatory principles. Sometimes the pain aspect of things can kind of push you into a different direction. Do you agree with that?
Yeah, and they're not really great pain relievers. If we're talking like if we want to get rid of somebody's pain, they might take the edge off, and that might be just enough in a certain situation. But this, the con is don't use it for every race. Don't use it for every workout. That's not a good idea. So we definitely want to stay away from that. So
we've used some exclamation points. That would be one where I would use right there.
Absolutely.
Don't use for everything.
Yep.
So beyond that, those are the questions that we got. Again, like Drew said, if you have additional questions through this process, please reach out to us, or if you feel comfortable, you can put them into the chat. We want to make sure that we are trying to keep you guys moving in that healthy, positive direction and continuing to put down the work that we all want to do, right?
Absolutely. Yeah, have some PRs this year.
Absolutely. We're going to take credit for it at this point. We put out enough videos that I think we're going to share in that wealth.
Aaron will, I will.
Well, we again, thank you for the time. We appreciate all the information that you guys threw out there. We greatly appreciate the feedback.
Yeah, absolutely.
And hopefully these help you in some capacity. Yeah. So get out there and do something magical, CTC.
Yeah. Have a great day.